Hello, and welcome to the 48th Annual AAKP National Patient Meeting, Transforming American Kidney Health, Patients Take the Lead. My name is Taiylor Kriss. I am an AAKP Ambassador for the state of Maryland, and I'm a kidney transplant recipient. I was diagnosed with Alport syndrome when I was just 18 months old, which has shaped my life in profound ways, inspiring my commitment to advocacy, holistic well-being, and empowering others on their unique health journeys. From enduring countless blood work, 24-hour urine tests, and nephrologist appointments as a child, to participating in clinical research studies, my kidney journey evolved into a transformative path. At age 22, I faced kidney failure and the challenges of dialysis, ultimately receiving the life-changing gift of a transplant just days before my 24th birthday. This journey fuels my dedication to supporting others in their pursuit of resilience, healing, and embracing life's challenges with grace and determination. Being an AAKP ambassador has provided the opportunity for me to delve deeper into the realm of innovation and research, staying at the forefront of advancements in kidney health. Advocacy is at the heart of my ambassadorship, as I passionately champion patients' rights and ensure that our voices are heard in healthcare decision-making processes. This role has also equipped me to make informed decisions for myself and others, leveraging knowledge and collaboration to drive positive change within the kidney community. Having been a peritoneal dialysis patient in the past and choosing a home treatment, I strongly believe that every patient should advocate for themselves and be the leader of their healthcare team. As an AAKP ambassador, I share the message that every kidney patient has the most important voice in determining their care plan. It is imperative that an environment is created that supports kidney disease research and innovations so that we are continually advancing care, improving treatments, and providing solutions for unmet patient needs. And when those innovations are FDA approved, it is crucial that all patients have access and the right to choose the treatment that is best for them in consultation with the doctor they choose to care for them, so every patient can live their best life and their aspirations. As an individual who has been impacted by kidney disease since birth, it's my honor to moderate today's session titled Bridging the Gap, Smoothing the Transition from Pediatric to Adolescent to Adult Kidney Care, as I've personally experienced all the ups and downs of transitioning through the stages of life with chronic disease. This is such an important topic, and it's a pleasure to introduce our speaker, Dr. Ruby Patel. Dr. Patel is a clinical assistant professor specializing in pediatric nephrology at Stanford University. She completed her pediatric nephrology fellowship at Stanford Children's Hospital and her residency and chief resident year at the Kaiser Permanente Northern California Pediatrics Residency Program. Dr. Patel is deeply committed to providing patient care, advocating for patients' needs, and conducting research to assess the effect of parent and peer relationships on medication adherence in adolescent transplant patients. Dr. Patel will address the importance of and how to support individuals from pediatric to adult kidney care. Dr. Patel, the floor is yours.
All right, thank you so much, Taiylor, and thank you, AAKP, for having me today. It's an honor to give this talk to everyone. So I've been asked to talk about bridging the gap or smoothing the transition from pediatric to adolescent to adult kidney care. And like Taiylor said, I'm Ruby Patel. I'm a pediatric nephrologist at Stanford Children's Hospital in Palo Alto, California. So during this talk, I'm going to be addressing a few different things. So just starting off with discussing some data around transition. A lot of it may seem like common knowledge, but I think it's important to set the framework. I'll discuss some realistic challenges that occur with the transition process, not only in patients with kidney disease, but anybody transitioning from pediatric to adult care. I'll review some current guidelines and toolkits that are available for patients and providers. And I'd like to discuss a little bit about what we've tried at Stanford and what I do with my own general nephrology patients. And then I'd love to, discuss as a group and hear from anyone in the audience if they have thoughts on future recommendations on how to improve the transition process. So, kidney care and making the transition from pediatric to adolescent to adult care has many unique challenges. Children and adolescents have a developing brain, and we've all heard of the developing frontal cortex and high risk-taking behaviors of adolescents. It's not all bad. Some of those risk-taking behaviors are necessary in adolescence to establish friend groups, to make some of those more stressful transitions from care within your parents' household to becoming an individual living on your own. And so it's really important that, adolescents do have some of those risk-taking behaviors, but it does create some challenges around transition of care. A unique challenge which we as providers have really not explored when it comes to transition specifically is how this age group is impacted in the setting of CKD in childhood. Maybe compared to an adolescent of the same age, a person managing severe CKD during their childhood may have even more challenges when it comes to executive function and decision making, simply because of their chronic CKD. Other unique challenges, which seem pretty common, are social factors and changes. A lot of pediatric patients who are going through that phase of adolescence and early adulthood, they may be graduating high school. They may be transitioning to work for the first time. Others may be choosing to pursue secondary education, and this may involve living independently for the first time. And something unique to 18-year-olds is they have legal autonomy for the first time as well. Of course, there are biological risk factors associated with late adolescence and early adulthood. Specifically, like for an example, it's transplant patients. There are some age-related immune system changes and some higher immune activity in teenagers and young adults that may explain a small subset of higher graft failure rates in this age group. There's, of course, non-adherence as a unique challenge or major risk factor in this age group. It could be related to the developing brain and risk-taking behaviors, but it could also be related to the challenge of transition itself. And then, of course, becoming prepared for independent decision-making during this age group. So, for example, adult-oriented transplant programs expect patients to be able to engage and discuss about their own healthcare and make decisions about various treatment options. And for some patients, this may be a realistic goal if they are prepared, but if they're not, this is an additional challenge that they face when going through transition. This transition of care from adolescence to adulthood coincides perfectly with what we call this high-risk window. An example is a high-risk window for graft failure in transplant patients. I don't think it's a coincidence that this transfer of care lines up exactly with this window, but I think in addition to all the unique challenges we just discussed, transition adds another layer of challenges for this age group. Pediatric Nephrology actually published a really great educational review in April of 2022, which sums up nicely the challenges around transition in kidney transplant patients. So for patients who were starting at the age of 12, we started to see higher graft failure rates in this age group. The peak or the highest graft failure was seen at ages 17 to 24, and then there's a clear decline in graft failure rates after that age group. Depending on other studies that you look at for patients who have undergone kidney transplant, simply entering adolescence puts them at a 20% higher risk of organ rejection and loss of their transplant as compared to other sex and socially matched age groups. And in this review article, specifically looking at graft failure, this pattern or this high-risk age window was the same regardless of race, sex, primary kidney disease, insurance type, and then a little bit more specific to transplant. It was the same regardless of if you were on dialysis prior to transplant, if you had a living or deceased donor, if you had high antibody levels prior to transplant, even when looking at HLA mismatch prior to transplant, still these graft failure rates peaked at ages 17 to 24. And which was really interesting was this was the same regardless of center and regardless of the center's transplant volume and how big the patient population was that they took care of. So really something important to think about, that this age group is at high risk, and especially in the transplant population, it's a little more simpler to quantify poor outcomes as looking at graft failure or organ rejection, but this is a similar challenge that we see with all adolescent age groups in this age range. But it's not all terrible stats. I want to take a step back and discuss transition in general. So, not just in people with a chronic disease or kidney transplant. So, in this 2022 study, over a 5-year period from 2016 to 2020, 55,000 teenagers ranging from ages 12 to 17 years old were asked about transition, and only 15 to 19% were ready for transition to adult care. This number did increase from 2016 to 2020, but an increase from 15 to 19% is still pretty terrible readiness transition scores. So how did this study define readiness for transition? Well, it was simply a survey. If the answer was yes to all 4 questions, then they were considered ready for transition. And the 4 questions were based off of this Child and Adolescent Health Measurement Initiative. The 4 questions that were looked at were, did the provider talk to the adolescent that eventually they would have to see an adult doctor? Did the provider work with the adolescent to help them gain skills to manage their own health? Did the provider work with the adolescent to help them understand the changes that would happen in their healthcare when they turned 18? And then lastly, during the most recent visit, did the provider speak privately with the adolescent? What was remarkable was that those, 15 to 19%, those that were more likely to be ready for transition were in fact adolescents with special healthcare needs. So maybe being a pediatric kidney patient or being somebody that has managed a chronic disease in childhood puts you at an advantage compared to the general population when it comes to transition readiness. But it's still not filled without its own challenges. Now, for the simple answer, the answer to solve all the barriers for transition, I would like to say, as far as I know, there is no simple answer to address transition for all patients. Transition for everyone is a challenge. There are numerous articles, discussions, provider and patient forums that talk about all of the challenges around transition. But regardless of the patient's diagnosis, whether it's CKD, transplant, diabetes, chronic lung disease, just to name a few, there are a few overlapping themes that help with transition and also create barriers when transitioning from adolescent to adult care. What I want to preface is many of the key features that help with effective transition are very patient dependent and unique to the patient. So some of the key features that overlap amongst any patient population is self-determination. If the patient or individual is determined to take ownership over their own health, over their medication, over understanding their disease, they're more likely to have an effective or successful transition. Patients who also hold themselves accountable or have a sense of accountability when it comes to, again, taking their medications, refilling them on time, requesting any refills, or talking to doctors about their questions, they tend to have more effective transition as well. It's also very important for providers and healthcare professionals to acknowledge differences in individuals and different barriers that patients might have around the time of transition. And I think it's really important, once you acknowledge those differences and complexities, to then address or provide them with additional resources. Recognition of vulnerabilities and the influence of culture and background. There are certain patients and families who won't ask for help when they have questions or they're confused about a certain topic related to their care. And recognizing that maybe in those persons you need to spend a little bit more time, maybe have additional follow-up to help bridge any gaps or barriers. Socioeconomic status also determines whether the transition will be more smooth or a little bit more challenging. So the more resources you have, the more health literacy you have, the easier it is to then transition from your pediatric provider to your adult provider. And then one overarching theme is early preparation and caregiver support for building the adolescent's knowledge of their health condition. Being more prepared at an early age about taking ownership over your own health and body really also makes that transition process a lot easier. And then on the flip side, Many barriers to transition, of course, one big one is inadequate communication between the family and the healthcare provider. If these discussions about transition don't happen early and it's a last minute kind of discussion at their appointment when they're 18 or 19, obviously that transition is not going to go as smoothly as somebody who's been communicating with their doctor about this process. We do know in families or patients who maybe have some limited education or a poor health literacy, that adds additional challenges to this transition period. Limited access to health services may also impact or be a big barrier. For example, if you simply can't come to your appointments, then you don't have those discussions and open communication related to your health and maybe your transition. We know language barriers add another level of complexity to this process. And then socioeconomic disadvantage, specifically underinsurance or uninsurance, also provides an additional challenge. So how can we address some of the gaps and challenges around transition? I think it's really important to engage all of the participants and then also all of our available resources when it comes to starting the discussion about transition and going through the remainder of the process. Just to talk briefly, there are many tools available to help navigate transition, but I'm not sure how many providers and patients have utilized these available tools. One, for example, is the survey that we talked about earlier in that 2022 article, where they simply asked 4 questions to determine if patients were ready for transition. Another very popular assessment tool is the TRACK questionnaire, which is applicable to any and all adolescents. It's a transition readiness assessment questionnaire, which goes through questions about your knowledge about your own health, as well as your medications and your ability to manage your medications and how you remember to take them. And it can help quantify which patients are maybe more ready to make that transition and are more responsible about their own health versus those that may need a little bit more assistance and resources around the transition process. And I think it's really important to list the key participants that are involved in transition. And obviously it's the patient, it's the parent and the guardian. Parent and guardians are, the ones that manage a lot of the patient's health in childhood, but moving towards a model where the patient is more autonomous and more in charge of their own health as they progress through adolescence and early adulthood. The provider is a really key participant, and it's plays an important role in bringing up transition early and making sure patients are prepared as they reach adulthood. In our clinic, we're lucky enough to have a full-time social worker that definitely helps with our patients around the transition process, specifically helping with any paperwork to ensure insurance coverage after the age of 18. And then our clinic is also very lucky to have strong nursing support, where we as providers can introduce some of the ideas and goals in our visits as it relates to health transition. But the nursing staff can then come in afterwards and set up follow-up visits to make sure kind of what we explained is understood by the patient and the families. Now, I do want to talk about some available toolkits that are out there for transition. These are a couple that are unique to kidney patients. And so there is a nice toolkit published by the Council for Nephrology Social Workers. It's available on the National Kidney Foundation website, and it's a general pediatric toolkit with a section dedicated to transition. I do want to talk a little bit more about the American Society of Transplant and their pediatric transition portal. It's a much more extensive resource that targets transition for transplant patients, but a lot of these tools are applicable for anybody with a chronic disease. And the way they organize their transition portal or this toolkit is by age. So early adolescents, ages 11 through 13, middle adolescents, ages 14 to 16, and late adolescents, ages 17 and older. And each age group has 4 tools. So one is the readiness assessment tool, which is filled out by the patient, the readiness checklist, which is reviewed by the provider, the patient, and the family, the transition action plan, and then the parent action form as well. And so we'll talk a little bit about each of these forms. So this is a screenshot of the readiness assessment tool for the early adolescent. It has a series of questions and various sections that are addressed, including knowledge about their transplant, their medications, questions about adherence, general questions related to risk-taking behaviors, and general questions related to overall health management. And these sections continue on in the other age groups, but the questions become a little bit more involved. So for example, the first question is, why did you need a transplant? And so asking the adolescent what their knowledge is as to why they needed their kidney transplant. As you can see, this same questionnaire for the middle adolescent, that first question is a little bit more involved. So not only are we asking why they needed a transplant, but the follow-up question is what is or was the name of their disease or condition that required them to need a transplant. So a little bit more involved in terms of the knowledge base that they should have as they get older. And then this late transition or late adolescent form for 17 years and older, again, has the same sections, but a little bit more involved questions. And I'm showing you these tools not to say that every transition program or every pediatric kidney doctor needs to implement these forms at every visit for a patient. But I think it's important for providers to know that these are goals that their patients should know by the time they reach a certain age. And setting that expectation early helps them to then be prepared to take on more responsibility about their health as they turn 18 and as they're older. One thing that I don't think is talked about enough is the real benefits of transitioning. As a pediatric provider, I know I always think, well, I have more availability, I have more ability to have frequent visits, and I have the capacity to have closer follow-up for my patients. So obviously that's a great thing. And transitioning to an adult provider, things may be different. But there are a lot of key benefits to making that transition at an appropriate age and time. So for example, adult providers allow for more autonomy. For some of my patients, this is a great thing. Less frequent labs, less frequent visits, less disturbance on their daily life, and they can continue on just checking in with their provider, a few times a year, as opposed to seeing me a lot more frequently. In California, availability of closer locations is really a big thing that adult providers have. In Northern California, there are 3 or 4 pediatric nephrology centers and only a couple that do dialysis in younger children and transplant. And so patients often have to travel 3 to 5 hours to come see me for their appointments and their kidney care. But if we can transition them to an adult doctor, a lot of the times they can find a provider in their same town or the town over, which makes travel a lot easier. I do also want to stress that adult providers are better equipped to manage adult issues. They know how to manage pregnancy and kidney disease. They know more about certain drug interactions, especially drugs that are a lot more common in adult patients. And they know how to manage other comorbidities, which we just generally don't see in pediatric patients, like, for example, gout and hyperuricemia in CKD. One thing I also like to stress with my patients is, yes, as your pediatric doctor, I've probably been there during your diagnosis and ongoing management of your kidney disease, but this new adult doctor is going to be there for the rest of your lifetime and the rest of your care. And although it's hard to make that transition and create that new relationship, this new relationship will also be a long-term or lifetime relationship. And then lastly, adult providers just have a larger fund of knowledge for more adult-related diagnoses and treatments. For example, when it comes to transplant, they have many protocols for transplant in highly sensitized patients. We do have similar protocols in pediatrics, but we don't have to utilize them as frequently because our patient population generally isn't as sensitized as adults who may be receiving their second or third kidney transplant. There are newer treatments that, again, are only available for adults, and adult providers are more familiar with prescribing them. Like, for example, for IgA nephropathy, some newer treatments that are undergoing clinical trials are only available to adults. And then there are certain conditions or diagnoses that don't cause a lot of problem in pediatric patients, but when you reach adulthood, maybe your 20s, 30s, or 40s, they become more of an issue. And an example of this is autosomal dominant polycystic kidney disease. And adult providers are much more familiar with management, medications that can be used to slow the progression of kidney dysfunction, and on newer ongoing treatments, which just simply aren't available to pediatric patients. So, what have we tried at Stanford? Well, we have a transition clinic, and we started that for transplant patients in particular. And I think, transplant patients are a unique population because most pediatric transplant centers also have an adult transplant center where a majority of their patients go to. It's a little bit more challenging to make that transition or identify that adult provider in general nephrology because patients can go to a various number of adult doctors who might be closer to their area, who may not be associated with the same pediatric center. So it's harder to have a set transition program for general nephrology. But in our transplant patients, this transition clinic is actually run by an adult nephrologist, adult transplant nephrologist, and a med peds fellow. It occurs once a month, and this clinic is in charge of managing the transplant care. So there is some input from the pediatric side, but a majority of the medical decision making is made by the adult team. And this clinic is reserved for challenging patients who need more frequent initial visits prior to transitioning completely to their adult nephrologist. And then the Med Peds Fellow brings their unique perspective, being trained in both taking care of pediatrics and adults, to address some of those transition challenges and making patients more ready to make that transition. For patients who don't necessarily go through our transition clinic, our transplant program has a process for transition, including starting to discuss some of those transition goals starting at age 12 to 16 years. We require that our patients establish with an adult primary care provider when they're 18, if not as late as 21. And then that adult provider helps place a referral to the adult nephrologist, who they set up an appointment with while still following in the pediatric transplant program. And then we then refer to an adult transplant nephrologist who will take over their care by the age of 22. And obviously, if patients are more ready to make this transition at a younger age, we do pursue it as young as 18. And what has worked for me as a provider? I might be somebody who's a little bit more familiar with some of these transition toolkits, some of these goals based off of patient age that we should be discussing with our kidney patients, simply because transition is a big interest of mine. And so I start the discussion very early. Maybe around age 11 or 12, I start setting the goal that my patients should know their diagnosis. They should know why they're coming to see me, and they should start managing some of their medications, at least knowing the names of them. And as they get older, taking more responsibility over their medications. My goal by the time they're 15 or 16 years old is making sure that they're comfortable talking to me as their doctor, as well as talking to their nurse, their pharmacy, and their insurance company. And the earlier they feel comfortable with this autonomy, I find that going through the later points of transition are a little bit easier. I like to also set up what the goals are for the patient and the family. A big one is surrounding work versus school when they turn 18. What does their adult life look like? And this helps guide discussions around long-term insurance coverage once they turn 18. And then I also like to have them meet with our social worker in clinic around the ages of 16 or 17 to help with any insurance transitions that may come up when they turn 18. And then for a unique patient population where maybe they will never be completely in charge of their own health and need somebody to look over their medical care, our social worker can help start the process for conservatorship in the state of California. And lucky for me, I work with a lot of great pediatricians who help families with this process as well. And then, this next point, it kind of varies depending on the patient and family's goal, but usually around age 18 or 19, I like to place that referral for the adult nephrologist. Not because I expect them to see the patient right away, but I like to get an appointment on the books in the upcoming, 6 to 12 months. I review, once my patients are 18 or 19 and we've placed that referral to adult nephrology, where they can find their medical summary on my chart, which is our healthcare system for patients. I also review with them what their insurance coverage looks like, what numbers they can call on their insurance to make sure that this adult nephrologist is within network. And then I also share the phone number for the adult nephrologist we've decided to refer to, just so they can call and confirm their appointment. And a lot of this is based off of family's preference and whatever provider is in network in terms of what adult nephrologist we place the referral to. And then I personally like to have an appointment with myself and the patient about 2 to 3 months prior to their first adult nephrology visit. And this is not for acute management of their kidney disease, but really to answer questions around transition. It is a nerve-wracking time, and it's scary to go from a doctor and system you're really familiar with to a completely new system. And I've been surprised with some of the questions that my patients bring up at these visits, but I really do think having this initial visit just makes them a little bit more prepared and relaxed to go to that first adult appointment. And so, again, the goal of this talk was to discuss barriers around transition and bridging that gap. And so, to summarize, a successful transition should be really individualized to the patient. There are tools that help providers and patients know like what goals or endpoints patients should know by a certain age, but really starting these discussions about their health, about their medications, and improving their medical knowledge about their disease and their body as early as possible is really important. And utilizing any and all resources that you have available in your pediatric clinics. For us, we're lucky to have social work and nursing support, but knowing what is available in your clinics for your patients is really important. And honestly, successful transition takes time. So spending that time during your visits, maybe a visit that is less complicated or there's not too much to discuss, going through some of those questions related to patient's own health literacy is really important. Or in my case, considering an extra visit focused on transition of care rather than medical management. And then I think it's really important for patients to become more involved. We as providers know the pediatric system really well. Adult providers know their workflows really well. But the patient is the one that goes through the transition. And so any feedback patients have for successful or even unsuccessful transitions, sharing that with providers and peers is really important. A lot of these toolkits are created by, providers, nurses, doctors, social workers, and it's really important that we have more of our patients' voices when it comes to this transition process. I think, this association, the AAKP, is an amazing platform for patients to take more ownership over their own health. And I think it's really important that you guys continue to be involved when it comes to discussions around transition. We at Stanford have a few programs that we take or our patients are involved in that help with transition and overall readiness as they transition from pediatric to adolescent care. One really helpful tool is our adolescent transplant camp, where maybe some of the older adolescents act as role models and show younger pediatric patients kind of what to strive towards when it comes to taking ownership over their own health and their transplant. We have nephrotic syndrome camp in Northern California, where families kind of discuss a lot of challenges around nephrotic syndrome and management. And then they have a once a year camp where patients get to meet one another. And of course, online forums is a good way for a lot of my patients who have undergone various types of transition to share their experience as well. Okay, so this slide is a list of my references that I used for this talk. I think, what I've discussed in this talk so far probably has raised a lot more questions around transition than answers. I think it's a really important and complicated topic, and we haven't actually solved the problem with all the barriers and challenges around transition. But it's an important process that every pediatric patient goes through, and so it's really important to keep having these discussions and figuring out what works for each patient. And so I want to thank you all for the opportunity to talk on this really special topic. And yeah, thank you all again.
Thank you, Dr. Patel, for the great presentation. AAKP has dedicated resources for patients and guardians of pediatric kidney disease patients. Check out the Pediatric Kidney Pals webpage on the AAKP website. It has lots of great educational and supportive resources, a link to sign up to receive AAKP's Pediatric Kidney Pals bi-monthly newsletter, a list of summer camps, links to AAKP webinars and articles, kid and kidney-friendly recipes, and much more. Visit www.aakp.org.